Okay, welcome everyone, and thank you for joining us this evening. My name is Russ Derry. I'm the Pediatric Epilepsy Program Coordinator at Mott Children's Hospital, and this is our Epilepsy Expert webinar for November, which is Epilepsy Awareness Month. And we have a very important topic to cover this month. The topic is supporting mental health in children with epilepsy, and I think this is a very a topic that applies to really all families, and in particular those dealing with epilepsy. And we're very pleased to have as our speaker Dr. Summer Chahine, who is a pediatric psychology fellow at Mott Children's Hospital. So with that, I will turn it over to Dr. Chahine, and if you can share your video and take it away, that'd be great.
Okay, well, my name again is Summer Shaheen. I'm a pediatric psychology fellow at Mott Children's Hospital. I'm going to talk about mental health specific to children with epilepsy. I'm going to talk about just mental health and epilepsy itself, the risk and protective factors, different treatments, epilepsy-specific factors that impact mental health and vice versa, and then specific resources for caregivers, school, other things you can do with children who have epilepsy. First, I'd like to start out with talking a little bit about epilepsy and like fact versus fiction, because there's a lot of stigma around it, which I'll talk about again in a little bit. But epilepsy is not a form of mental illness. It's a well-documented neurological condition that affects the brain's electrical activity. So people with epilepsy are not less intelligent than those without epilepsy. This is a fiction, a myth that's out there. But people with epilepsy are not less intelligent than those without epilepsy. While some people with epilepsy might have cognitive impairments, these are more often related to the underlying cause of the epilepsy, such as like a brain injury, rather than the epilepsy itself. So additionally, mental health challenges cannot cause epilepsy. There's another diagnosis called non-epileptic or psychogenic non-epileptic seizures, which I'll talk about a little bit later. But mental health challenges are not a cause of epilepsy. Epilepsy is a physical disorder and it has a neurological basis. And while emotional stress can trigger seizures in some people, it's not the underlying cause of epilepsy at all. So I wanted to point some of those things out first at the beginning. But yeah, the next thing I want to talk about is the youth mental health crisis, which is a really big issue that we've got going on right now. There's the more recent reasons for mental health crisis is due to like a lot of the social isolation and the academic disruption that many people experienced during COVID. So the last 3 or so years have been really tough on a lot of people, of course, but many youth also have lost caregivers to COVID, have had a parent lose their job, or were victims of physical or emotional abuse at home during this time period. All of these difficulties kind of on top of the growing concerns about social media, mass violence, natural disasters, climate change, political polarization, and, you know, not to mention the normal ups and downs of childhood and adolescence can really feel like insurmountable at times. But a regular screening for anxiety for kids between the age of 8 and 18 and depression screenings for adolescents from 12 to 18 years old are really recommended and super important. And as we all know, mental health is also just really important in general. It's found that 3 to 5 times, children with epilepsy are 3 to 5 times more likely to have mental health concerns. They're at risk for lower health-related quality of life. And they have an increased lifetime morbidity and mortality rate as well because of this. And I wanted to share some statistics and research related to this as well. But 17.1 million young people in the US have a mental health disorder by the time they turn 18. Girls in particular are really in crisis. And according to the CDC, reports from earlier this year that almost 60% of US teen girls said they felt persistently sad or hopeless, which is pretty significant. Suicide is also the second leading cause of death for teens and young adults right now, especially those ages 10 to 34. And almost 19% of high school students reported having seriously considered suicide in the past year. This percentage is higher with females, which is about 24%. And then lesbian, gay, or bisexual teens goes up to about 47%. In addition, about 9% of high school students attempted suicide in the past year. And this percentage is highest with females at about 11%, Black teens at about 12%, and then lesbian, gay, or bisexual teens, which is about 23%. And I also want to mention that I will be sharing my slides after my presentation, just so you guys can have all of the data and all of the things that I'm sharing as well too. So yes, I want to talk a little bit about depression. So prevalence rate is about 14%. Some signs of the symptoms of depression include sadness or a depressed mood, increased irritability, decreased interest or pleasure in activities that someone would typically find interesting or things that they would enjoy, decrease or increase in appetite, decrease or increase in sleep, fatigue or feeling tired, moving slowly or seeming restless, feelings of guilt or worthlessness, difficulties concentrating, and then thinking of death or suicide. And I'll talk again in a little bit about how you can kind of figure these out, questions to ask your child or your adolescent, and things you can do to support them as well. But childhood and adolescent depression, it's frequently underrecognized and undertreated in children who have epilepsy. And actually up to 30% of children and adolescents who have been diagnosed with seizures also have depression, as well as anxiety. So 40% of children with epilepsy develop an anxiety disorder at some point. And one study had found this with epilepsy, children developing anxiety disorders with those who are diagnosed with epilepsy compared to just under 9% of children who don't have epilepsy. Other studies have also found the prevalence of anxiety disorders might be even as high as 50% for children with epilepsy as well. And in general, again, like I said, the prevalence rate of anxiety is about 9 to 10% in general, but the prevalence rate just in the general population of those with epilepsy is about 19%. And again, there's many different types of anxiety disorders, which I'll talk about. But again, individuals with epilepsy experience anxiety at a rate that's 3 times the level of the general population, which is pretty high. Next, I want to talk about like ectal anxiety versus panic attacks. A lot of people ask questions about this. So ectal anxiety, it's anxiety as a symptom of the seizure, occurs in patients with focal types of seizures, and awareness might be maintained or kind of reduced. So patients, kids with this suddenly experience intense anxiety or panic, and sometimes combined with other known phenomenon that occur kind of in the temporal lobe along where the seizure occurs, is like deja vu or other symptoms as well, kind of occur along that same pathway. But distinguishing the ectal anxiety from a non-epileptic panic attack can present a pretty challenging, like I guess, diagnostic challenge. But typical features of an ectal anxiety attack are sudden onset of anxiety that kind of comes out of the blue, shortness of duration, and then the automaticity of it. So how quickly or automatically it happens. So non-epileptic, I guess the difference between that and the non-epileptic panic attacks, the panic attacks usually last longer. They're often stress related, and the scans when after the fact are usually normal. So ectal anxiety is reported to occur in about 15 to 20% of patients with medical temporal lobe epilepsy. And then a panic attack is a sudden episode of like intense fear that triggers the severe physical reactions when there is no real danger or apparent cause. Panic attacks can be frightening, But when they do happen, you might think, or the person having the panic attack might feel like they're losing control, having a heart attack. It's described that way, as well as other symptoms. They also, panic attacks have a lot of variation, but the symptoms usually peak within minutes. So you might feel, fatigued, worn out after a panic attack stops. Panic attacks also kind of include some of the symptoms, sense of like impending doom or danger, fear of losing control or fear of death, kind of rapid or pounding heart rate, sweating, shaking, shortness of breath, feeling like tightness in your throat or your chest, having chills or hot flashes, nausea, abdominal cramping, headaches, dizziness, lightheadedness, fainting, feeling numb or tingling, and then feelings of unreality or feelings of detachment as well. So that's some of the ways that you can kind of figure out if it's an ectal anxiety or a panic attack, as well as just some of the other medical tests and the scans that they do. Where panic attacks, the scans after usually are normal, versus ectal anxiety, they won't be, because it goes along with a epileptic event. So like I said before, there's a lot of different anxiety disorders. The prevalence is 19%. Signs of, I guess, generalized anxiety are really excessive worry about a lot of different things. The worry is very challenging to control. A lot of physical and like cognitive symptoms, feeling restless or like on edge. People with generalized anxiety tire easily, or they're more fatigued than usual. They experience impaired concentration or feeling as though their mind is going blank. Some people are irritable, which may or may not be observable to others. Some of the irritability that comes with anxiety sometimes isn't internal and just the person experiences it. And then other times, other people can see that. There's also increased muscle aches or soreness, and then difficulty sleeping, whether it's falling asleep or staying asleep, feeling restless at night, or the sleep is just not satisfactory. The other thing that occurs pretty commonly with kids and adolescents with with epilepsy is phobias. The prevalence is about 8% of those with epilepsy, and can come with just the fear of seizures, the fear of blood or injections, or agoraphobia. So being afraid to leave an environment one considers safe. So whether that's like their home environment and they worry that if they go to school, they're going to have a seizure, what other people are going to think of them if they're out in public, things like that. And then OCD is also something that comes up for those with epilepsy, where the prevalence rate is about 14 to 22%. And these are thoughts, behaviors, things that come up that are recurrent, intrusive, a lot of unpleasant thoughts, and can be relieved by a compulsive action. And I want to talk a little more specifically about separation anxiety as well. So those with epilepsy sometimes experience separation anxiety, which can be things that you might notice are just like the recurrent excessive distress when, they're anticipating or experiencing separation from home or from major attachment figures, persistent or excessive worry about losing major attachment figures, about possible harm to them, illness, injury, disasters, worrying if they're going to die, persistent or excessive worry about experiencing an unexpected event, or like an untoward event, I guess. So like getting lost, being kidnapped, having an accident, becoming ill, that causes separation from a major attachment figure. So concerns about is something going to happen to them that's going to make them lose that person. Persistent reluctance or refusal to go out, away from home, school, work, or anywhere else because of fear of separation, as well as the persistent and excessive fear or a reluctance about being alone or without the major attachment figure at home or in other settings. Same with reluctance or refusal to sleep away from home or to go to sleep without being near the major attachment figure. And then repeated nightmares involving the theme of separation. And repeated complaints of physical symptoms, so like headaches or stomach aches or nausea or vomiting, when separation from that attachment figure occurs or is anticipated. So something you might notice is children often saying like, oh, my stomach hurts, kind of in the morning before they go to school. And that sometimes, of course, we'll keep them away from going to school. If school is a place that they're worried about going to, or if they know that they say my stomach hurts, they'll get to stay home away from school, but then their parent doesn't like go to work or something and the parent is at home with them. So they kind of get out of both, but then they're also not away from the attachment figure. So sometimes you might notice behaviors like that, or children, adolescents, saying various things like that as well. But more importantly, I want to talk about the impact of anxiety and mental health on epilepsy itself, because this is a bit different than someone without epilepsy. So anxiety in children with epilepsy often comes up in response to the unpredictability and the lack of control associated with seizures. So children might overestimate the threat that's posed by future seizures or underestimate their ability to cope with their seizures. So anticipatory anxiety might include worrying about the threat of having a seizure. Things like social phobias might develop for a fear of having a seizure in public and being embarrassed, or what are other people going to say about me, things like that. And then children with anxiety might also, I guess, appear, I guess, more clingy than usual. They might be more restless or fidgety, complain of stomach aches, express negative thoughts or kind of generalized worrying, display changes in like eating or sleeping habits, have bouts of unexplained crying, have overwhelming panic attacks or acute panic attacks that seem to come out of nowhere, but then they're pretty intense, getting upset or angry more quickly, and then have some OCD tendencies in some kids and teens as well. So in terms of the unpredictability and the demands of epilepsy, it's really tough for kids and teens, and I think for caregivers as well, because of the inability to control the seizure sometimes, or the feelings that you can't control what's going on. So the decreased ability to control the seizures can also contribute to the mental health challenges. In addition to seizure-related disorders, there might be other influences on a person's mental health. So for example, like medications for epilepsy, anti-epileptic drugs are used to control seizures, and then these drugs can cause side effects also, like the disruption of sleep patterns, drowsiness, fatigue, dizziness, nausea, cognitive changes like being a little more like slow or processing their thoughts a little more slowly than normal, difficulties with memory, paying attention or concentrating, and also mood changes. So this includes like an increased risk of suicidal thoughts sometimes in some kids and teens, depending on their medication and the way they respond to it. Other changes you might notice in the unpredictability of epilepsy is sleep deprivation. So epilepsy can cause sleep deprivation, and which can then trigger seizures sometimes. Frequent seizures while sleeping can cause anxiety about going to sleep, which can disrupt sleep even further. And then poor sleep can lead to hyperactivity, inattention, depression, or even anxiety. And lack of sleep also makes a person more irritable, short-tempered, and less able to handle stress. And then to talk a little more about stress, it increases the risk of mental health challenges in people with epilepsy. And stress in early childhood can disrupt the development of the structures of the brain, which are responsible for mood regulation and emotion as well, making those things more challenging. And stress can affect sleep by making it more difficult to fall asleep, alter sleep structure, lead to poor quality sleep, and then increase the frequency and intensity of nightmares as well. So you can see that all of these things can of course build on top of each other, sometimes turn into like the snowball effect where one thing happens and it leads to one of these other things and makes it really tough on mental health and just like managing that stuff. But I will in a little bit get to some of the coping and things that we can do to support kids and teens. I wanted to take a minute and mention the psychogenic non-epileptic seizures as well. So these seizures, or the non-epileptic seizures, involve events that resemble epilepsy-related seizures in terms of symptoms and signs, but abnormal electrical activity in the brain doesn't cause them. Instead, these seizures, or the non-epileptic seizures, are a physical reaction to underlying psychological stress. Mental stress is being converted into a physical symptom with these events specifically. And it's possible for someone to have both the psychogenic non-epileptic seizures as well as epilepsy-related seizures. Some common, motor activity might see side-to-side head movement, pelvic thrusting, eye closure. It looks pretty similar to an epileptic event, but like the cause and what you see on a scan is very different, and the way that we treat them, of course, will be different as well. So next I want to talk about the social impact in the way that we think about it in terms of like friendship and our surroundings, but as well as some of the things we might experience both externally and internally within ourselves. So things like stigma, discrimination, how it impacts us, how we perceive things and our experiences, anxiety, the unpredictability, kind of like I talked about, and some of the social consequences of these experiences as well. So stigma, what is it? It's a negative label of judgment that people put on others who are different from them in some way. So things like race or gender, sexual orientation, or health condition. This can make the person feel ashamed or isolated or discriminated against and can prevent them from being treated fairly or getting the help they need. Children with epilepsy are particularly vulnerable to experiencing stigma, and so much so, in fact, that parents might even withhold the medical diagnosis from school personnel for fear of the stigma their child might face. In terms of the discrimination in epilepsy, there's something called like enacted stigma, which also can be referred to as discrimination, which refers to the actual behavior or actions that people take toward those who are stigmatized, such as excluding them, teasing or harassing them, bullying, or even violence. And I'm going to talk about bullying more in depth in a little bit as well, because that's something a lot of kids and teens with epilepsy also face. And then there's like the felt stigma and with epilepsy. So that's sometimes that we call like internalized or self stigma, which refers to the negative beliefs, feelings, and attitudes that people who are experiencing the epilepsy, who belong to the stigmatized group, I guess, might have about themselves as a result of stereotypes, societal things that people say, or how people act towards them, and the discrimination that they've experienced. So for example, I guess a child with like epilepsy might internalize a negative message about the condition and then begin to feel ashamed or embarrassed about it. So this can lead to a child feeling lonely or isolated, powerless, shame, or embarrassment. And then social consequences of epilepsy. So children with it often experience both enacted stigma and felt stigma, and can have social consequences like difficulty making new friends, partially due to lower self-esteem and reduced confidence in social situations, social exclusion, due to the fear or misunderstanding of seizures by their peers or adults, or fears of getting hurt. And then difficulty with transitions. So due to the concerns about disclosure and stigma, potentially like moving or starting a new school, things like that can be especially difficult, as well as the things that I kind of mentioned before. And then personal impacts of epilepsy. So it won't be a surprise that in addition to the social impact of stigma, there might be significant personal impacts that a child experiences as a result of the stigma. So feeling powerless, feeling insecure, self-isolation, depending on others, even when they think they like quote should be more independent, feeling shame, feelings of being less than or inferior, which are of course I think difficult for anyone to experience those feelings, but it's especially tough for children and teenagers with epilepsy to experience these things and kind of manage those feelings. Um, so some strategies everyone can use to support a child with epilepsy: providing a safe and supportive environment by promoting a culture of acceptance. So encourage open communication without fear or judgment, identifying those at risk, whether it's a child of yours, someone that you work with, someone that you know. Um, it's important to identify who might be at risk, and recognize some of the symptoms kind of that I talked about in kids and teens. Providing referrals to school mental health services or even mental health professionals out in the community, who can support with anxiety and mood and coping, but also there's mental health professionals who have an expertise in working with kids and teens with epilepsy, and those would be good people to refer to as well. Um, Offering accommodations and flexibility as people need it, as well as like in the school environment. And then educating, caregivers and people at school and other adults and people that children spend time with on the signs and symptoms of depression and anxiety, learning how to screen for it, what to ask for, and what to do if they do identify a child that they're concerned about. And then normalize seeking help for mental health concerns is really important. It's getting better, of course, but there's still some stigma attached to mental health, and it's important to send the message to children and teens and everyone that it's okay to ask for help, um, and that's okay. And then fostering a positive, culture, whether this is at school and advocating for children in the school setting, um, things that promote inclusion and kindness and empathy, establishing peer support programs through school or in partnership with local organizations, um, promoting self-care, so like exercise, meditation, other coping strategies. I'll talk about some more in a little bit too. Um, but again, I want to go back to bullying because this is a really big concern, something significant going on in schools and kind of just the world right now. And it's something I want to address and talk about, and just signs of bullying, how to support kids. But yeah, a recent report or research study that had done noted that as many as 20% of children and teens with epilepsy experience suicidal thoughts at some point in their life. So these statistics are frightening to all of us. And studies have shown that children with epilepsy were more frequently victims of bullying than were their classmates or students with another chronic illness. So things that help, what can we do? Research shows that the most effective interventions are providing epilepsy first aid training for teachers and staff, encouraging teachers to create a supportive classroom environment, teaching students about epilepsy and their peers and their friends, talking to the coaches and other people on sports teams and clubs and all the other things they're involved in, empowering students with epilepsy to be advocates, but also being advocates for them. Reinforcing the fact that children who have situations that others don't understand are more likely targets of bullying, and this includes epilepsy. Demystifying the condition of epilepsy and encourage a helping mindset. So that first slide I shared with all of you, those are some ways to demystify the condition of epilepsy and how to talk about it with people, and letting the child know that you're a supportive advocate, and we'll be there for them to help them with situations as they come up. Supporting might be responding to seizures or helping with things like bullying behavior. So there's a lot of roles that you can play um, in the life of a child with epilepsy, and that a lot of the ones that I just listed are different ways to do that. Either having like a seizure action plan and teaching people how to respond to it if you're not around, helping things with bullying behavior and advocating for them, seeking mental health support for them. All of those things are really wonderful ways to support a child with epilepsy. And then some signs a child might be being bullied. Some of them are really similar to the symptoms of like depression and anxiety that I shared, and some of them are a little bit different. But if the child starts acting differently, seeming anxious, not sleeping well, not eating as expected, or like, quote, what's normal for them, not doing the things they usually enjoy, appearing moody or more sensitive, and that, excuse me, avoiding certain situations. Ways to respond is to listen carefully to the child or the teen to learn what's going on at school or in your child's social circles. Make sure your child knows that you care about their situation, hear their concerns, and then consider their feelings to be important. Letting them know that, but then also validating their feelings on top of that. And also asking if your child has any ideas for how they would like to see things handled if there's something happening that makes them uncomfortable. So if you're out and about and a child's like, this situation makes me uncomfortable, your child might themselves actually have ideas about how they want that handled in the future and ways that you can support them in those situations kind of moving forward. Sometimes they have specific ideas about what might help, and what might make things worse. And then you can advocate for them in that way by kind of responding in the way that they ask. Of course, if it's appropriate. These ideas might not be, of course, universally accurate, and they might change depending on the environment, who's around, what you're doing, but it can let you know their perspective, which can be helpful in talking with like school group leaders, other people involved in the child's life. Also praise your child for talking about it. These things are really hard to experience as it is. And I think, when a child feels comfortable enough with you or an adult or someone to talk about it, praising them for it is really important and helps kind of reinforce that you're a safe person for them to talk to about the concerns and the things they're experiencing as well. Again, not easy to talk about difficult things, especially ones that might be scary for a person, might feel unsafe or vulnerable at a time when they feel kind of already vulnerable or due to being victimized. This is especially true as kids head toward adolescence and feel like they're supposed to handle things for themselves. Making sure that you're letting them know that you're an advocate and are there to support them in however they need is really important. Childhood to adolescence, and even further than that. So a few suggestions, if you should have particular concerns about a child hurting themselves. So don't wait. If you ever have a concern, just get help from other people or agencies that specialize in crisis intervention, and suicide prevention. So there's this new-ish, I think it came out in July, number 988 that you can text, you can call. It's a suicide and crisis lifeline. So 988. And again, I will share my slides so you'll have these resources as well. But remove the method if there is one that someone is trying to use to harm themselves, such as any weapons or pills. Get involved and be available. So showing interest and support, be direct and talk openly and matter-of-factly about suicide. So something that mental health professionals and physicians that are asked a lot of the time is like, I worry about asking if someone wants to hurt themselves or ask about suicide because I worry that I'm going to put the thought in their head. I know that that's something that people worry about a lot, but by you asking, you're not putting a thought in their head. if that thought was already there, it was already there before you even asked. And by you asking, it's not going to put in a new thought or something. If the answer is no, I haven't thought about that or wanted to do that or hurt myself, the answer is no. But by asking is just upfront and being direct is really important. And then really listening and allowing them to express their feelings is another way to really support. So different ways of coping, I guess. So guidance, I guess, for working with children or teens, letting them know, like, hey, if you feel safe or targeted, make sure you tell a trusted adult, whether it's you as their caregiver, a teacher, a coach, whoever it is, just have them, tell a trusted adult. Letting your child or adolescent know, like, avoid the people who display bullying behavior, stick with friends, use the buddy system, excuse me. Holding angry responses to bullying behavior. Bullies thrive on the angry responses that sometimes we turn to first, and it can make them feel more powerful. Kind of like the thought, like, oh, look what I just made you do. And firmly telling the bully to stop, removing themselves from the situation, talking about it with trusted adults, whether that's parents, teachers, mentors, coaches, group leaders, whoever it is. And helping them to work to build or rebuild confidence. So bullying tends to cause people to doubt themselves and question why they may be targeted. Helps to spend time with people who understand us and will help remind us that we're wonderful, valuable human beings who don't deserve to be treated this way. And those are different ways that you can talk to your child or teen about these things. In terms of just looking at epilepsy in the context of a person, looking at a person's lived experience kind of in the context of the biopsychosocial model, should be understood that, individuals' capacities to cope, tolerate, and accept chronic illness or anything that's going on, including pain, entails a lot of levels of experience and thought, and you can kind of see that on this chart. So this specific model suggests that illness disrupts the biological, the interpersonal, spiritual relationships that are unique to the individual. This model also recognizes the potential impact of different variables that might increase or decrease the experience of illness. And I just wanted to showcase this and show you that, like, looking at a person is, I guess, a person is more than a thing. They are more than their epilepsy. They are more than their mental health. There's a lot of factors that need to be taken into consideration about how something impacts a person or how that, like, vice versa, and how they're going to manage that. And all of these things are really important, factors to consider. Our biological risk factors in mental health. So again, another piece of this pie chart kind of chart situation, the type of epilepsy, the frequency or the intractability of the seizures, any changes in a person's brain due to the seizures, any cognitive changes due to the seizures, how early they're diagnosed or how early or late the seizures start happening, any psychiatric or mental health history, family history of also, medical things, seizures, mental health, their sleep prior to the seizures, but also things that might change related to sleep after they start having them, the medications, the AEDs, the medications that they're on, and then if there's any substance use or abuse that's going on as well. And then the social risk factors, we talked about a little bit of them a while ago, but this can also include things like financial stress, poor academic achievement, low expectations, unemployment in the future, or if teenagers have to quit jobs and all of that, the inability to drive, of course, if someone's having epileptic events, they're not allowed to drive, challenges with relationships, the stigma that I talked about, and then some of the isolation that some people experience as well. And of course, there's some protective factors related to the epilepsy and the mental health and how well someone might do with coping and managing. So positive social relationships, physical activity and involvement in like sports and clubs and engagement in social activities, a good diet, a better prognosis when they're younger at the age of their diagnosis, positive and strong family and peer relationships, good community support and school support, um, opportunities to pursue hobbies and interests and staying engaged in those things as well. Um, and then in terms of just like overall diagnosis of mental health conditions, if you ever were to have a concern about this, diagnosis can be made by any certified mental health professional, so psychologists, psychiatrists, social workers. It's important to have an evaluation of the symptoms or history, the risk and protective factors, as well as any psychological testing or treatment planning and recommendations that need to take place. I think it's in a future slide, but I'll talk about it right now. One of the, I guess, a couple of good ways to find a mental health provider is calling your insurance. They always will have a list of mental health providers that accept your insurance. That's a good place to start. The other really good place that I tend to send people sometimes is psychologytoday.com. It's a website where you can put in, where you live. You can search for providers, like mental health providers by where you live, insurance they take, your presenting concern, um, age age of your child or teen or your age, if you want family therapy, individual therapy, all of that stuff. It's really detailed and there's a lot of filters in there that you can use to find a provider that's going to fit as well. And then just overall, treatment and resources I want to talk about and kind of end with that. So again, the epilepsy specific factors impacting mental health, all of these things that I've talked about today, the unpredictability that sometimes comes with epilepsy, the trauma that people have experienced in the past or kind of throughout life, stigma, bullying, sleep problems, any cognitive challenges. I didn't mention this earlier, but parental overprotection sometimes takes place and it's hard for, I think caregivers just in general, like you want to protect your child, you want to make sure they're safe. But sometimes that limits some of the things that they can do. But I think working with, your physicians and figuring out the limits and what your child can be involved in and over time slowly like adding in more things and kind of seeing how they do is a really good way to approach that as well while trying to keep them safe. A lot of restrictions sometimes are put on kids with epilepsy. So that can be tough. Like, you turn 16, you're excited to like drive, and sometimes you can't, and that's a restriction placed on you. And that alone is really tough, I think, for an adolescent to cope and manage with when they see all of their friends doing it, or it's something, they really looked forward to, and now they can't. So things like that. Grief and loss, and not grief and loss in just the sense of like a death, maybe how we think about it, but there's also the grief and loss of like, you know, things have been quote unquote like normal. I've been able to do all of these things for so long, and then they start having epileptic seizures. And then all of a sudden they can't do some of the things they used to be able to do. And the grief and loss with that can be tough to manage and comes with a lot of changes. So those are things to think about. The fear of having seizures in public, side effects of medication, which I talked about, and then the periactal symptoms or the ectal anxiety I talked about as well. How to find a therapist, there it is. Sometimes there's mental health providers kind of already embedded within epilepsy programs, or who your neurologist might work with. So asking those questions in those spaces might be helpful as well. You can ask your primary care doctor for referrals. Sometimes like neurology offices will have social workers kind of embedded in them. Looking for psychologists who work at hospitals or academic medical centers specifically. Again, calling your insurance company Psychology Today. Other things you can do. So cognitive behavioral therapy, acceptance commitment therapy, mindfulness, guided imagery. So therapies like cognitive behavioral therapy have shown efficacy for a lot of physical disorders as well as pain, but are also efficacious for psychiatric illnesses and emotional concerns. So CBT helps to develop an important set of coping skills that is intended to kind of improve psychological functioning, including behavioral activation, structured relaxation exercises, recalling and scheduling of, pleasurable activities and events. And CBT also addresses maladaptive thoughts, and catastrophizing through formal use of cognitive restructuring or reframing some of the thoughts that some of us have that might get in the way sometimes. So acceptance and commitment therapy, or ACT, it's an approach that implies that thoughts don't basically have to be changed or targeted, but the responses to these thoughts might be altered in a way that the resulting negative consequences are kind of gone. So for example, ACT approaches can kind of augment the sense of well-being through like purposeful, non-judgmental acknowledgement of mental events, like our emotions, our thoughts, which really helps to facilitate the acceptance of those events and kind of helps to enhance, I guess, the capability of someone to sustain a present and be present of what they're experiencing, as well as, relevant environment and psychological factors as well. So it's just very much about acceptance and living your life in a way that meets your values and fits in line with your values. So kind of keeping that in mind, kids, teens, adults, all who might be able to modify their behavior in a way that's in line with their goals and their values, instead of keeping focus on the immediate relief from their emotions and thoughts. So I guess kind of while both tying, some management and relief from emotional pain, ACT can boost awareness or purposeful awareness with acceptance, which kind of diverts, I guess, the focus on decreasing some of the pain they experience or the emotional pain, and some of the thought content attached to that, and redirects their efforts to trying to achieve more favorable or fulfilling behavior. Then more specifically about emotional pain, feelings can easily become overwhelming. So it's important that kids have the tools to unpack what they're experiencing. And emotional awareness is an especially important skill because it allows children to identify what they feel and break kind of those multi-layered emotions into more manageable pieces. So helping your child develop emotional awareness by kind of reflecting back what you notice them feeling. So over time, this will help them to label their emotions on their own. And thinking about this too, kind of in general, like most people will welcome more of like those positive experiences, like happiness and calmness and being content, into their lives more readily than sadness, anger, or fear. So trying to remember that each of these feelings has an equally important purpose. So for example, like fear signals that we need to be wary and alert. Grief confirms the value of our relationships. But feelings are a lot like road signs, conveying the important information for the journey through life. And feelings, although they can be painful, and trying to avoid them only makes them more powerful. So working through those difficult emotions when they come up increases our tolerance for those uncomfortable feelings and prepares us for challenges ahead or other things that might come up. And then spending time with the full range of emotions really allows kids to form thoughtful and kind attitudes toward those feelings. But helps to build resilience and helps them experience emotions kind of across the spectrum more fully. So those are ways to really, I guess, think about some of the emotional pain and difficulties they might experience and how to kind of approach it and think about it. So I mentioned this a little bit, but I'll go through it again. Things that caregivers and adults can do at home, having a seizure action plan, having a daily structure and clear expectations, build in reminders, open communication, talking about emotions, paying extra attention towards successes and adaptive, coping strategies, and being able to really manage some of those tough feelings. Focusing on sleep hygiene, being active, even trying different relaxation strategies. So when I send out the slides, they will also be linked to some videos that you can use to look at some of these relaxation strategies. So like different breathing things, progressive muscle relaxation, guided imagery, various books that you can use or look at. There's a lot of apps that are helpful, different websites as well. And then getting back to school, so talking about a 504 plan or an IEP with the school, finding ways to talk to others at school, whether it's teachers or other students, about seizures and how to support your child, bullying, the seizure action plan again, especially having one for school, and then starting transitioning sleep to a school schedule. I know when kids and teens are out of school for a little bit, sometimes their sleep is like the first thing to go, and also the hardest thing to get back on a schedule. So thinking about that ahead of time and kind of transitioning their sleep before they get back into school. And then for caregivers, because there's a lot going on, and when you have to support your child, you have to support yourself as well. So it's really important that you all take care of yourselves. Using support networks, I'll share some of them again in the slides when I send them out to you. Looking to friendships and family members, talking to medical and mental health providers, social workers, the school nurse, and if you have a local epilepsy foundation, any organizations or online forums that you can find as well. And again, I will share some with you. And then other resources, these are already linked, so I will send those out to you as well. But yes, that is all for me. Does anyone have, I guess, any questions?
Yeah, thank you so much, Dr. Chaheen. Have a few minutes for questions. Does anyone have any questions or comments that you wanted to share in terms of strategies that you found helpful in supporting your child with mental health? And you can, if you have a question, you can unmute yourself, or you can feel free to type it in the chat.
Yeah, I think for me, some of the things I've told other people that I've worked with before is like integrating that into a schedule. So, you know, I think people do really well with schedules and routines anyway. So finding ways to incorporate that into your day, um, as it is anyway. So, it can be when they wake up, it can be before they go to bed, after school, before dinner, different things like that. And there's also, relaxation strategies that like there's the typical meditation, but then there's also the strategies that are kind of similar to meditation, um, like breathing strategies, other things like that they can be adapted to use during school even, or sports, especially if they are feeling anxious or having a tough time. So there's ways to adapt them, and then I will also be including some of that when I send out the slides as well.
Okay, thanks.
Yeah, that's a really, really good question. I think it's tough when we feel like we're so busy and we don't have the time, but there's definitely ways to, I think, adapt some of the strategies that we would use in various settings as well. Because I think for kids and teens, sometimes it's hard because you don't want to make it obvious that you're practicing a breathing strategy or you're doing something, of course, because you don't want to bring attention to yourself. But there's ways to do it that's really discreet, and that you're doing it for yourself and no one knows that you're doing it. Some of the things that we've done before too is like included in a child's 504 IEP plan, the ability to take breaks when they need to go to a separate room and spend time doing some of their relaxation or coping strategies, especially if they're having a really hard time.
And there are so many different types that can be effective. I think another thing is to have your child try multiple different types until they find one that really works for them, and one that is easy to practice, and one that is is easy to integrate into daily life. And because I think, again, the more you practice it, the more it becomes almost an automatic. You can almost automatically go into it in a stressful situation to be able to reduce your stress, that kind of acute stress. But but also doing it on a regular basis helps to reduce that chronic stress, that both of which can be seizure triggers. So I think it's such an important question to about how to integrate those types of relaxation techniques into daily life.
Yeah.
Other questions? We have maybe we can take one more question.
Yeah, so kind of just like the independence piece of things. Yeah, I think that varies, per person, of course, but I think figuring out what strategies for managing this has kind of worked over the last few years into high school. A lot of people start to gain independence throughout high school. So finding ways that they've been able to kind of manage that, and having plans in place for, like, if they are going off to college and kind of away from home, for if they're in certain environments, how are they going to manage it? Who is going to help them if they do have a seizure? Within colleges, there's also kind of like having the 504 IEP in place. Each college has some kind of office. It could be, I don't know. I think, like, my college, for example, a while ago had disability student services. So things like that, where they can talk to someone and get special accommodations for their classes, to help them kind of with the schoolwork, but other accommodations that they might need as well. And figuring out, slowly figuring out what their limitations are. Like, are there environments that are more stressful for them? How are they going to manage that? How do they limit it with social engagements and things like that as well? I think are all important things to think about.
All right. Well, Dr. Shaheen, thanks again for a really informative presentation, and thanks for staying a little late for some
Course.
questions. And if anyone does have any additional questions, you can please feel free to contact me. I'll put my phone number in here.
Yep, and I put my email in there too if anyone has any other questions.
Yep. So feel free to give me a call. We do have a caregiver support group that meets every Tuesday at 1:00. That's when I would say a good 30-40% of what we talk about are mental health issues for both caregivers and children with epilepsy. So definitely encourage you to give that a try if you haven't. And again, thank you for a really great presentation, and I hope you all found it helpful.